Hi, my name's Nichole Hamilton. I'm from Synergy Physio. Now, these next series of videos that we'll be sharing with you are to help guide you with your post-operative care following your hip replacement. It's really important to know that the exercises in these videos are simply a guideline and not a recipe. Some of you will be stronger than others, and a lot of that will depend on how you were in the lead up to your surgery. So if you've had arthritic hip pain for many years and have been limping for a very long time, then it's very likely that you have quite a weak hip, which means if some of the exercises are too strong or too difficult for you, you're better off sticking with the easier exercises and gradually building on your repetitions until you're ready to move to a harder exercise. So keep that in your mind. You don't need to progress at any particular rate. It's not a race. You'll just do what your body can and start to build on your strength slowly and in accordance with your own body. Now, just as a general idea, after your hip replacement, you'll come out of your surgery with 2 crutches. It's quite normal to stay on 2 crutches for up to a week or 2 weeks. I've seen people stay on 2 crutches for 3 weeks, and that's just fine. What we want to do with the crutches is to make sure that you're avoiding a limping pattern. Once you've been on 2 crutches comfortably, you can then progress down to 1 crutch, and that normally happens at about the 2 to 3 week mark. It's quite normal after your surgery to have some swelling around your hip, either at the back or the front, and sometimes even tracking down into the knee. That's completely normal. What we don't want is any heat or any redness around the wound. So if you have any heat or redness, then you need to contact your doctor to make sure that you get your wound checked. After you've had your wound checked at about the 14-day mark, and you have the wound dressings removed, once your scabs have fallen off, you can start a little bit of massage through the front or around the side of the leg in order to start mobilizing some of that tissue and softening the scar. If you've had an anterior hip replacement, it's actually quite normal to have some numbness at the front of the thigh. That numbness will be there for quite some time, but will gradually get smaller with time. If you've had a posterior hip replacement, it's important that you know and understand that you cannot bend your hip above 90 degrees for a minimum of 6 weeks and probably longer. Now, the reason is if you bend your hip more than 90 degrees, there is an increased risk of dislocating your hip. Now, it doesn't mean that if you bend greater than 90 that you will dislocate. It just means that the risk is greater. And the times that I tend to have seen this happen, and it's very rare, is usually when someone is sitting on a chair that's too low and then go to bend forward to pick up something or try to put on their shoe or sock. So if you've had a posterior hip replacement, it's essential that you stick with chairs that are high, which means your hips are going to be higher than your knees. If you're not sure if the chair is too low, simply back up to a chair. If the chair is touching the back of your leg below your knee crease, then it's too low. So the chair needs to be at the knee crease or a little bit higher, and then you know that that chair is not too low. So straight after your surgery, for the first 2 weeks, you'll be doing some very simple exercises that we take you through. You'll be pretty tired for the first 2 weeks, partly because of the anaesthetic and the hospital visit, but also in the first few weeks especially, your prosthesis and your body is healing, which takes energy and time. So it's important in that first few weeks that you have regular rest breaks. You might need a little bit of a nap in the afternoon. Don't resist it. Make sure you do that just to give yourself plenty of rest. You will be able to walk on your hip replacement straight away. It can take the load. The prosthesis is perfectly fine to take your body weight. It'll just take a little bit of time getting used to it, which is why you use the crutches to start with. I recommend to all of my hip replacement patients that you're better off doing a little bit of exercise and often throughout the day. So that means your physio program 2 or 3 times a day, plus a few gentle walks throughout the day and plenty of rest breaks in between. As your fatigue starts to settle, usually by about the 3-week mark, people start to feel a little bit less fatigued. Their pain medication is reducing and their pain levels are a little easier. By that stage, we can start to increase our distance of walking. Now, how far to walk, I think, needs to be guided by your own body. If you feel pain, excessive pain or fatigue, then you've just done too much. And you'll always have a day where you think, oh, I've done too much today. That's okay, have a rest day on the next day. You're better off doing 2 short walks a day than 1 big long one, because that helps to pace out your activities. So if you have any questions that you need answered throughout your exercise program, please feel free to contact us here at Synergy Physio. Also know that at night time, for the first couple of weeks, you'll be more comfortable lying flat on your back. Over the sort of 3 to 6 week mark, I generally find that people do start to lie on their side more comfortably. A pillow between the knees does help. Your prosthesis will probably be uncomfortable to lie on for up to 6 weeks, and that's actually quite normal. So remember, for the first 6 weeks, it's really about allowing your prosthesis and your body to recover from your surgery. You can't make this go faster. You can't do more exercise and think that you'll recover quicker, because no matter what happens, it's going to take 6 weeks. So have a little patience with yourself. Make sure you take plenty of rest breaks, do your exercises regularly, and if you've got questions, then we're very happy to help you.